This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm feeling today extremely board certified.
Are you?
Amy. Yeah.
That's good.
More than normal.
More than normal. Well, maybe it's because of our recent episode we talked about why it's important to be board certified.
That's probably what it is.
So you just know how important it is now.
Yeah, I feel very board certified today.
That's very good. We have a really exciting episode today. First, for anyone who is just listening only, if you'd like to watch the video that goes along with this, you can find this on YouTube at Jason Martin MD. It's not going to be very interesting from a slide standpoint because we're answering your questions, and a couple of them are actually voicemails. So we have two voicemails. We have two questions that were actually on YouTube.
Okay. So it should be viewer and listener questions, really, if we're being correct.
Just people questions.
They're always listeners. They're never just viewers.
Oh,
That's
gotcha.
True. Well, I mean, maybe.
Yeah.
You guys are good looking, though.
Amy is.
So without further ado, how about we just jump right into our first question?
Let's go for it.
Okay.
Hi, Jessica here from Western Colorado. First of all, thank you for answering my previous question about removing cysts during breast work. I have more questions regarding breast issues for y'all. When I was pregnant with my first child, I developed a lump under one of my armpits. My OBGYN said that it was excess breast material, that I should probably expect it to never go away, ever, and he was correct. It even filled with milk when I was breastfeeding, which was extremely uncomfortable and hard to manipulate out of there. But my questions are, is there a name for this condition? How common or uncommon is it? And how is this removed? Like, is it a lipo procedure or like a cut and scoop it out kind of procedure? So those are my questions. Look forward to hearing you on your episode about that. And thanks again. It's always fun to hear. Well, I actually watch you on YouTube, so it's always fun to watch y'all. You always make me smile. Thanks so much.
So, Jessica, first off, thank you so much for watching and listening.
And thank you for using y'all. I like that.
It's very sweet.
It makes me feel part of your family.
So I love this one because I know you like to answer questions about technical things. So what is the technical term for this condition?
It's accessory breast tissue. That's what it is.
And why?
Accessory.
Why would it stay dormant until she got pregnant?
Well, like when you get pregnant, you got all those hormones running around and prolactin, and it stimulates whatever breast, the ductal system that's in there to make milk, just like it does underneath your nipple and areola.
Right. So it's breast tissue that was always there.
Yep.
So it's not like this tissue grew out of spontaneity after you were developed.
What's the tail of the breast called? The tail of...
The breast? The breast tail?
No, it's called the tail of Spence.
Oh.
S-P-E-N-C-E.
That's what the breast tail?
Yeah, the breast tail that goes up toward your armpit.
That's
so
the
there's
tail
breast
of Spence.
tissue there. Yeah. And people have what they call accessory breast tissue, which just means it's in front of your armpit. It's very common. I don't know the percentage of people that have it, but for some reason, I get a lot of those patients.
I wouldn't say a lot. I mean, I'd say it's pretty uncommon. I would say that's something that most women
Well, we get at
don't
least a couple a year.
experience. Yeah.
That's a lot to me.
Yeah.
Yeah. Maybe not.
Maybe not. I mean, I think in the grand scheme of women, it's probably not that many.
Yeah, that's a good point.
I would
In
say
the grand
though,
scheme of my practice, it's very common. But
we see it more often than we see accessory nipples.
Yeah. Extranumerary nipples. Yeah. Extranumerary nipples. Yeah. So accessory breast tissue is, as Amy said, probably not common, but it's not unusual. I mean, we've seen multiple patients with this problem. What that means is you have extra breast tissue that's near your armpit. It's probably extension from your breast, but it could be separate breast tissue. We've seen that too. When people get enlarged breasts, that can enlarge both with pregnancy and weight gain and other things. And it can be a problem. When you have what's it called when the milk comes in? Didn't we do an episode on this?
Oh, the witch's milk?
The witch's milk.
We did that in the gynecomastia episode,
exactly.
actually.
Man, that is an OG.
The very first gynecomastia episode.
Wow.
Yeah.
The witch's milk. And we just talked about how that's really disturbing. It's this disturbing
That's in
name.
a neonate. That's in a baby.
Right.
Yeah.
So when that milk comes in, it can also be in that area. The problem with that is not just the fact that it fills up with milk and it's uncomfortable, is that it's unsightly sometimes too, especially with certain clothes that really show the anterior portion or the forward portion of your armpit. And what the definitive procedure is to take it out, to remove it en bloc, to remove all the tissue. That's with an incision that goes right in front of your armpit. And actually it's pretty well hidden. A little bit of it with your arms down will be evidence if you're watching on the YouTube channel up front, but you just remove everything. And by the way, I send that off to the pathologist because that area of breast tissue can get breast cancer too. And FYI, that area should be visualized in a mammogram, but it may not always be. Those up in the tail near your armpit can hide breast cancers that sometimes aren't caught on mammograms. So, and if you have a history of breast cancer in your family or there's some breast cancer concern, obviously you want to send that tissue off if it's removed.
Well, anytime we take out breast tissue, really, we send it off.
All the time.
Just because, I mean, why not? It's a chance to know information that you don't normally know.
Right.
Anytime you excise something from the body, you can find out what it is. I definitely think, though, most women who do have this condition and do get milk filling that area kind of say the same thing that Jessica said, is that it's very difficult to express the milk from there. So like it's uncomfortable for many reasons. So, I mean, I would think from a medical standpoint, do you think it would be advised to get it removed versus leave it and see what happens?
Yeah, that's interesting. You say that because you know what I thought when she was talking? It was like, well, the OBGYN just kind of brushed her off.
Right. This is going to be there forever and whatever.
Yeah, it's like, sorry about your 12 noses.
Yeah.
It's like, at least you can smell better than other people. I don't get that.
Right.
But I know the ones that I've done up in the mountains, I know they were covered under insurance. Accessory breast tissue is a code that insurance companies use, and there is a CPT code, an insurance covered code for excision of that tissue. For sure.
Yeah. So what about if she was going to have more children? Would you remove it before or after?
Before.
What about the risk of not being able to breastfeed?
That won't happen, but the problem you would be concerned about is you don't remove all the tissue.
And it grows again.
It grows again and it kind of splits open that, scar line.
Right.
So you could have that where the milk fills into that area.
Pushes through your scar.
The disaster situation would be...
That'd be a lot of engorgements.
I know. Well, the disaster situation would be that you excise it, but then all of a sudden, like inadvertently, you get pregnant, or you simultaneously excise, get pregnant, right? And then that's healing, and then that grows, and then it starts to produce milk, which would be a disaster for wound healing.
Yeah.
So
that would be very rare.
Very rare. Which is why, the way, we don't do breast augmentations on people that are breastfeeding, just for this reason.
Well, yeah, there's a lot of reasons, but that's one of them. So in summary for Jessica, this breast tissue will stay for your life. It's been there all your life. And if it's bothersome, you can definitely have it removed. Might be covered by insurance.
Yeah, we think so.
But
we
either
don't know.
way, you can have it removed.
And to your OBGYN, you can tell her that you listen to Dr. Martin. And Dr. Martin says that these are diagnosable problems that can be fixed.
Well, yeah. And you've had this breast tissue all your life also.
Oh, yeah. Okay.
Yeah. Yeah. It's like having a sixth toe that just like pops out in your, like in your 40s. Like, oh, look at that little guy.
I just don't like when people, like, I'm sure it was different. I'm sure the conversation was different, but I always feel like doctors kind of brush things off.
Like, oh, yeah.
Yeah. If that OBGYN, I'm assuming she's female, I'm making an assumption.
I would assume that he is male.
Okay. Or female. Yeah. He said, what did he say? Did she say he?
I think she said he.
Oh, okay.
Did you say he said? Yeah.
We'll listen to it
See,
afterwards.
I guess 99% of the OBGYNs I've seen in my entire life have been men.
What?
Yeah. But female OBGYN once in my entire life.
Well, that's not my experience in medicine, and I'm actually a doctor that experiences medicine. So
From the OBGYN side?
Every OBGYN that I have seen at the hospital or come in contact with has been female besides gynecologic surgeons. I'm not even joking.
And those were all men?
They were all men.
Yeah, well, I don't know.
And maybe that's an age-related thing?
Maybe the hospitalists are women?
Yeah, it's interesting.
Because in clinic, they're all men.
Rarely do you and I are like different on these kind of things. It's so interesting.
Well, I mean...
If I would have put money on it, if you would have asked me before, if someone came up and said, here's $1,000, what's Amy going to say? I would have said, of course she's going to say It's a woman.
Now one. And I actually searched for a female OBGYN on purpose finally at one point in time.
Oh, it's just so interesting.
Because they were all men.
Interesting. Okay.
How many female men doctors have you been to?
None. How many female urologists are there? There was one in the mountains that we knew.
Yeah, we know one in Florida.
That's a good point.
Yeah. So we know two.
We know two.
All right. Well, off topic.
Good talk.
Yeah, good talk. Okay. So let's go to our next one. This is actually a question from YouTube. This is from David. David says, do you perform a direct excision platysmaplasty? Are internal sutures permanent? Are there any neck tightness or choking sensation concerns? 3 very good questions.
Very, very good questions. We do direct excision neck lifts, and I know that because we did one yesterday. We do platysmaplasties with a direct neck excision. We did not do that yesterday because he did not have banding, but it's very easy to do. You know why? Because you're directly looking right at it. And of course, there will be tightness after these procedures. And that tightness is welcome because you know that you're making the area of concern flat again. It will loosen up over time. It will be more tight if you do the platysmaplasty. It will be less tight if you only do skin alone. And yesterday we only did skin alone. We saw him today, and he was really in not much discomfort at all.
He was in none at all. Really.
Yeah.
The skin excision only, I've never had a patient tell me that they felt like they were choking or couldn't swallow. But when we do an aggressive like platysmaplasty, like putting those internal sutures in, those people do sometimes have that sensation of maybe not being able to swallow fully for the first few days is usually it. And that's just because of a combination of the increased tightness, but also inflammation.
Yeah.
I've never had someone complain of that, past that point of those first 72 hours. I mean, it feels tight, yes, but that feeling of feeling like there's a lot of pressure that's uncomfortable or that there's somebody pushing against your
even
trachea.
like a choking feeling. It's
really rare.
It's rare.
It happens, but it's usually very short-lived. But some people do feel like there's pressure, on their trachea. Like they'll say, I feel like there's pressure. I'm like, well, there's pressure from the inflammation is more so than the pressure from the actual suturing. It's just kind of a combination of both.
So, Amy, what is the platysma muscle?
It is a wide, thin band of muscle that goes from your jaw down to your clavicle.
Yeah. The clavicle is your
Collarbone.
Mm-hmm. And then your jaw is your mandible. So this whole expanse, if you're looking on YouTube, from your jaw down to your collarbone,
It's wide.
Why it has a muscle. It's a really thin muscle. So when men do this and they shave, what am I doing?
Like flexing your platysma?
Yeah, basically. When you really tighten your neck, and you're tightening that platysma
Clench your
muscle.
jaw really
Yeah.
hard.
So the muscle is kind of strong, actually, but it's not like a muscle that supports your head or your spine or your arms. It's not like a joint muscle. It's
it's not a mover.
It's very thin. It's almost like paper thin. The problem with over time is that muscle in the midline can kind of roll on itself and create something called bands. Those are vertical bands. You don't see that in young people. You definitely see it in older people. And what you do is you go in there and you actually divide that muscle a little bit down below, more near the collarbone, and then you sew it up in the middle like a corset. I keep using the word corset, knowing full well that people under 30 don't even know what a corset is.
No one under 30 wants a direct excision neck lift, so you're safe.
Okay, good.
And if you think that people under 30 don't know what a corset is, you are incorrect. And I'm happy that you are because you have a 16-year-old daughter
Okay.
who is clearly not wearing corsets.
Why do all of a sudden I feel anxious and nauseous?
Yep, trust me, they know what it is.
So, yeah, and that's what you do. You create a corset in the midline. So one of the things, they talked about internal sutures being permanent. I skipped that question. It's a really, really good question. You think David's like a plastic surgeon?
Nope.
Secretly?
I don't.
Okay. Anyways.
You would have asked a much more complex question
No,
than
but
this.
he could have been kind of hiding it a little bit. So most of the time
do you
I
think
do.
you needed to know the answer for a test? Is
Yeah,
that?
long-acting sutures. Permanent sutures can be used on the neck, and I do actually use permanent sutures on the platysma, but I do it on the outside, not the inside. The problem with permanent sutures in the midline is that, number one, you can get some bowstringing here, and those sutures can become palpable or irritating. So if you're going to use permanent sutures in the midline, which I have used before, you got to be very careful about the size of the suture. It can't be too big. What I've been using lately is sutures that are barbed. They're called quill sutures, like a quill on a porcupine. They only go in one direction. You put them in, and they last for 45 to 60 days. Those sutures tend to hold very well, and I don't get reoccurrence of the platysmal banding. I'm good either way. The data on the for platysmaplasty is you can use either type, and there really is no preference. But I don't have a problem with permanent sutures.
Yeah, I think the only one issue that you didn't bring up with the suture diameter or type is also the color. Permanent sutures tend to not be clear. They tend to be a darker color. So we've run into this. We talked about this on our podcast about otoplasty or ear pinning. There's a very heavyweight suture that we use, but it's really blue in color. So in very rare cases, when that skin is really thin behind the ear, kind of like it is on the neck, you can actually perceive the color there. Now, behind the ear, it's not really an issue because no one's really looking in the crease where your ear meets your head. But on your neck, that could potentially be an issue.
Yeah. So nylons, they make clear nylons. That's a permanent suture. Prolines, I'm sure they do, but I've never seen a clear proline.
I've only seen blue.
I haven't.
Or purple.
One of the other options that you could do is and then the other issue with permanent sutures is when you tie the knot and you cut the suture, the
little tails.
The tails that stick out with permanent sutures that are monofilament can be really irritating. And if they're underneath your skin, you could feel them in really thin areas. So you could take permanent suture and do one layer and bury the knot. I'm getting really into the weeds, assuming that David is a plastic surgeon. I got you, David. I'm watching you, man. You could bury the knot and then do another layer of like an absorbable suture, kind of imbricate it like I do sometimes with tummy tucks.
Yeah, like
really,
lightweight.
That is a good question. Direct neck excisions are awesome. The case we did yesterday is amazing. And it took me, I looked at it, 50 minutes, 5-0.
Yeah.
Under local anesthesia. You walk in, you walk out, and you're done.
Yeah, this patient, no medication at all. He didn't even take Tylenol.
Nope.
Had like literally no discomfort.
So, Amy, what's the downside of a direct neck excision?
You have an incision directly in front of your trachea.
So
right in the midline of your neck.
Below your chin, the midline of your neck, pretty almost to the base of your neck in some cases.
Yeah. Well, and for men, I mean, like right over your Adam's apple. So like you have a scar that's going to run straight down the middle of your neck.
Midline. And how do you feel about it?
I mean,
honestly.
Me personally, about the surgery or about the scar?
No, the scar over time.
The scar over time looks great. I mean, I've never seen the scar look bad, whereas the skin before definitely does. So is the scar noticeable to a layperson? No. I mean, do I see it? Yes. But that's because I know it's there and I'm purposefully looking at it to check it. We've never had a patient who had any problems with it either. And in some cases, some men, I mean, depending on their age and their skin type, I mean, it's healed so well you can almost barely perceive it, even when you know it's there.
Especially with men because they have beards that go on the neck. Even when they shave, there's still like that little stubble, and it tends to just hide those scars.
It really hides it, and just the texture of men's neck skin is a little bit thicker,
right?
So the scar just looks better.
So the general person that does the direct excision neck lift is in their 70s and male. Or 70s or older, but I think definitely. I think females are candidates too.
Yeah, we've had a few women reach out to us who were interested because they were either not a candidate for a full neck lift for whatever reason, or they just really didn't want to go down that route.
What would be the reason? Yeah, is either choice, and that was the guy yesterday. He was perfectly healthy. He could have done a neck lift. He's like, I don't want it.
Yep.
He goes, I want the 50-minute option, and I want to get back out and do what I'm doing. The other reason would be if you have medical conditions. Diabetes, high blood pressure, things that preclude you from doing major surgery, or you just don't want general anesthesia. So
yeah, if you just don't want to do anesthesia, it's a great option. We have a whole episode where we talk about direct excision neck lifts. If you're interested, we show some pictures. It's really a great episode to listen to.
I wonder what the analytics are in that episode. I would like to know. They're good. Yeah.
All right. Well, we're going to take a quick break to get a word from our sponsor, and we'll be back with 2 more questions.
I'm going to go get checked. Are you going to get checked?
I'm going to get checked.
All right.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly, And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right, we're back. So we have another voicemail and another regular or written question, I guess I should say, typed question.
Yeah, we've been getting a lot more voicemails, a lot more questions, and it's been awesome.
Yeah, I like the voicemails. All right. So our next one is a voicemail again. This one is from Marie.
Hi, guys. This is Marie from Seattle. I'm calling. I have a question about Revian, the light therapy for hair loss. I'm really excited about using the OmniLight, but I was wondering if you could kind of address this, if it's any good, if it's proven. I have my partner is very upset about the hair loss that's happening for him. So we were hoping you could give us some feedback on that. Love the show. Can't wait to actually set up a consultation with you guys. I'll talk to you later. Bye.
What is it with these partners? I need to have like a therapy session with all the partners out there.
To like make them schedule their own appointments?
No.
Ask their own questions?
Yeah. Like every partner always seems to have an issue. I don't know.
Oh, well, I mean, their issue is hair loss.
Yeah.
Yeah. So this is a great question. I love that you're using your Omnilux light. I love mine. I use it literally every day. So yeah, I love light therapy. Interestingly enough, there is a great study that was done on hair loss specifically. Do you mind if I start on this one?
No, please.
It was really cool because it was done in younger men.
To be honest with you, you know probably more about hair loss than I do.
Yeah, so they specifically did 3 different types of therapy. They did light therapy, they did dermal rolling, and then they did like the traditional, what's the not brand name for Rogaine?
I know what you're saying.
Yeah, so basically the medication that's in Rogaine, and followed these men over the course.
Is it finasteride? I can't remember.
Finasteride?
Yeah.
No, amoxicillin's the antibiotic. Yeah. So they followed all these men and kind of looked at the difference.
Minoxidil?
Minoxidil.
Is that what you're thinking?
That's what I was
Yep,
Yeah.
minoxidil.
Okay.
So they did see that, yes, there was actually regrowth in men who were struggling with premature hair loss. Now, the type of hair loss that someone is experiencing is going to obviously vary greatly, and that's going to definitely dictate what type of treatment is appropriate. But at least in small-sized minoxidil, at least in some small trials with red light or with light therapy, they do see hair thickening and hair regrowth. Why that occurs, we don't really truly know. Why LED lights really do what they do in a tissue and cellular substance. Basically, they excite the cells. So they make the cells excited. That, in theory, is what makes the hair grow in more thickly and more quantity. So there are specific head lights. So they're a light that you sit directly on the head or the scalp.
They actually look like bike helmets.
They do look like a bike helmet.
It's very interesting looking.
Yeah. They get really warm like your Omnilux light does. That's a really challenging thing to say.
Here we go. She's
Omnilux
starting.
light.
She's not drunk. This is what
Omnilux
happens to her
light.
during normal times.
Omnilux light.
Just keep saying it over and over.
Yeah, that's so you try.
Yeah, okay. I'm not doing it.
Yeah. So they're usually a longer duration. So whereas with your mask, it's a 10-minute treatment time, they're usually up to an hour.
Yeah.
So it's much longer treatment time. It's a little bit more intense light setting. So those are my thoughts.
I mean, if the question is, does it work? Yes. How much does it work? It's really, I don't know. I think it depends on the person. Mm-hmm. The etiology of hair loss and hair thinning can be so variant. You could have thyroid issues. It could be due to your hormones. It could be due to aging, male pattern baldness, stress, testosterone fluctuations in men. There's so many different things. So it's not one-to-one. That's one of the reasons that Amy and I have really not chosen to go full bore into hair regeneration, because it can be kind of difficult. Mm-hmm. It takes a lot of effort, and you really have to go through a lot of stuff with the patients if you do it correctly. But as we've said before, light therapy, name all the negatives of light therapy.
There's zero.
Time.
You look weird with a helmet on your head for an hour.
And you make all your loved ones ask what the hell you're doing, which if you want to laugh, just go back into our episode on our grab bag, stuff we're into. And Amy pulled that out and she wore it and she looked like you were going to murder somebody.
Terrifying. Yeah, it's terrifying. It's my Halloween costume.
There's no question, FYI, there's no question that light therapy works. Now, the question is, will the Omnilux laying in the areas of hair loss be enough?
No.
It probably won't be. That's why those helmets are good. Number one, some of them are different wavelengths and definitely more energy involved. The reason why Omnilux is not going to be as much energy as you're doing it around your eyes, when you have it as a kind of helmet on your head, they're assuming you're not wearing it right over your face. So they're going to have some luxuries there related to your eyes.
I'm pretty sure they use a combination of blue lights with all the hair.
I think they do.
Well.
I don't want to say for sure because I think Amy's right, but definitely they do combination lights. I'm just not exactly unsure of the exact wavelengths.
Yeah. So, and like I said, the duration of treatment is longer. So it's a longer time on the actual head than like your normal mask is going to be. So that, if your partner is interested and could be dedicated to doing it, because it's not instant. And that's the other thing, especially with, I'm going to say men, that if you don't see instant results, you might stop doing it. And it can take months, before you really would see any improvement, because hair growth cycles are pretty long. So you're not going to see a change immediately. You might not even see a change over 3 months. It might be like 6 months before you really see a big difference in the amount of thickness or the quality of the hair, So keep that in mind too. It does take a commitment.
The growth phases of hair follicles tend to be months long, and
which is why we don't go bald when our hair's
right
in between haircuts.
Hair is so interesting.
Yeah.
So chemotherapy patients tend to lose hair with certain chemotherapy medications, and one of the things they do now is actually they do this chilling head wrap. Mm-hmm.
Or like the helmet too. They used to do.
It's a helmet. That runs really cold water. It's kind of uncomfortable. And that's been shown to decrease the activity of those hair follicles during the administration of the chemotherapy, which then it's not absorbing as much of that chemotherapy agent, and then the hair follicle lives, which is very interesting. It's the opposite of light therapy. You're trying to knock it down to salvage it so it can survive and not be totally destroyed from the chemotherapy. So
it works.
It absolutely works. Which is crazy. Yeah, it is cool. It's cold too.
Yeah, it's very cool.
That's good. It's a good question.
Yeah.
I don't know. Amy and I are so pro light therapy. So I mean, I'm sure there's people. For sure there's other things you can do that are going to be more efficient than light therapy. But I definitely think it's positive.
Yeah. I mean, so yes, I would say the answer is yes. Asterisk. In some situations.
And by the way, we love Seattle. We were just talking about Macklemore yesterday, Amy's favorite rapper, and the Sounders, which is their soccer team. So, and I think they just got a hockey team too.
They did.
Yeah.
Yeah. First season.
All right. Let's go. Go
Yeah,
Seattle.
all kinds of sports. All right. So let's get our next question. This is a short one, but a great question. So you had asked, this was during our podcast about Accutite, and you said there was basically like nowhere that you could not Accutite. And you put out a request to listeners to tell you new areas for Accutite. So Elise wrote,
You know what's so crazy about this? I'm just reading. Oh, go ahead.
is Accutite a soft palate snoring solution?
Oh my God. This is so brilliant. It probably would be.
Yeah, she asked, like, could you use it on the soft
I
palate
think you
for
probably
snoring?
could. I will not do that study. I will not do that.
But what do you think the mechanism would be? Why would it work?
Okay, so snoring in itself, or again, we got to make it real clear. We're not like a sleep specialist, or we're not ear, nose, and throat doctors that do airway issues. But I was trained in that kind of stuff. So the posterior or oral pharyngeal area, the area at the back of your throat, can collapse down at nighttime. That's where you see some people who, even of normal weight, can have sleep apnea and problems
just, like,
there.
super aggressive snoring.
Right.
Yeah.
The soft palate is additive to that closing in of the space. So you can, and that could be hypertrophic or obstructing. And so what you can do is go there and ablate that with different types of energy. They already do that.
With lasers, yeah.
And it's not just the soft palate. I think it's the walls, the pillars, the areas where you have your tonsils. They can take tonsils out. They can do tonsillectomies. There's a lot of different surgeries really in the back of your mouth that they do for airway issues. So I think 100% Accutite could be used. I want to tell Elise that she is very creative, or this is somebody from InMode, from the company itself. They're like, I saw Martin's podcast. We went right into there as a patient.
See if you could treat soft palates. I mean, how it would be difficult.
I don't know how you would
It would be
maneuver
challenging
it.
to treat.
Well, what you would do, I got it all figured out. Amy.
Okay.
Okay, I have the surgery in my head. Don't worry, Elise.
Okay.
I'm going to write this up. So what you would do is you would have the patient lay supine on the table with their head extended, okay? And you would come from the back, the top of their head down. The problem is you would have to numb up that area
You'd have to numb it. You'd also have to keep it.
and keep the airway open at the same time.
Yeah, that's what I
without
was going to say.
having
The airway issue would be.
This is turning kind of problematic.
They'd have to be asleep, I think would be the key, because you'd have to be retracting.
If
the
they're asleep,
tongue.
then it defeats the whole purpose of Accutite. We have to do this awake. Elise, what we're going to do is, Amy has agreed.
I'm going to run the suction.
Yeah.
To keep your airway clear of blood.
No, you
and
are
fluid.
Amy. We're going to do it on you because we would only do it on you first.
Okay.
We'll do it on Amy afterwards. We will videotape it. You can follow us on Instagram, and I'll
I don't
post that later.
snore.
What?
I don't snore.
I don't really either.
So how are we going to know if it worked?
So, but definitely doing ablative techniques in the back, like the back of the throat or whatever, the tonsillar pillars, the soft palate. Yeah, that stuff's been used. Again, we're not experts, but yeah, Accutite, you could use it there. Such a creative question.
Yeah. So I told you this was the one that was like unusual. I'm like,
This may be the best question we've got.
Right.
I know this is way off topic, but like the fact that she listened to our podcast and then thought of a very intelligent question. So thank you.
See, and that's why we had to answer it on the podcast, because me just writing like, maybe, not so interesting to read. Like, thanks guys, maybe, sure could try.
What was the one we came up with? Earlobes?
Well, I think earlobes would actually be a great place
Yeah.
to treat. And actually really the very, very anteriorly to the ear.
Right, that little crepey
Where,
area.
where you get that
They
loose
already
skin.
do labia. I know they've done labia with Accutite. I'm sure someone's done the back of the hands.
Yeah, that was one of their initial indications was
Yeah.
hands. We've actually done it on the hands, and I'm not super impressed.
Not really.
Hands are a difficult area to treat for a lot of reasons. Yeah.
I don't know any other places. Between the webs of the toes. I don't know. To rejuvenate them.
I was going to say, what's your end game with that one?
I don't know. Make them look better.
Well, let me ask you a question, like along this same like snoring issue, palate issue. What do you think of the tonsils?
Oh God, this is such a loaded question.
Who in this room has their tonsils still?
I do.
Really? I'm the only one that
Big.
I don't have mine. I had my tonsils removed when I was 12.
I should have.
Yeah, the surgeon told me that when I woke up, it was going to feel like a bulldozer had run over my throat. And I was like, oh, I got this. Like, I've had strep throat every 2 weeks my entire life. And literally when I woke up, that was my thought. Like, I was like, I remember waking up and like I could see people, but I was kind of on my own, right? Like, I could see that like maybe one of my parents was over there and like the nurse. And I was like begging anybody for water, but like no voice was coming out because my mouth was so dry.
Oh, that's terrible.
So like I couldn't actually speak, and I was just like pleading with like, you know.
Yeah, with no words.
To like, please have water. Yeah.
Yeah.
So, I mean, I guess from a nutritional therapy standpoint, you know, that's one of the questions I ask people is if they still have their tonsils, because they play such a massively huge role in the immune system and the immune function. So to me, it's pretty interesting to know, you know, people that do and do not have their tonsils, and then kind of understand maybe their history of like gut dysbiosis, weight management issues, like other things that are connected, history of other illnesses. So it's really fascinating.
Cutting to the chase, you're saying you should have your tonsils.
I mean, if it is medically necessitated that they be removed, I think maybe they should be. But if you can keep your tonsils, it might be worth keeping
And then
them.
what about your molars?
I mean, I wish I had my you mean your wisdom teeth?
I mean, sorry, your wisdom.
Yeah, I feel pretty strongly about wanting my wisdom teeth back. I'm keeping these too.
You're just like a real disruptor in Western medicine.
I mean, why would we yank teeth out of a perfectly healthy mouth?
Well, I was listening to this podcast, and they were talking about, it was so interesting. They were talking about evolution. And they said, why would evolution evolve to have wisdom teeth if they're supposed to be removed? Right? It's been hundreds of millions of years that we've developed these. And the thought process is that we now just recently feed our kids such soft diets,
Right.
that the teeth and the bones need tension or axial pressure to develop and harden and grow. And all we've done for these, you know, kids from 0 to 5 is give them soft smoothie kind of things. Where in a long time ago they would eat regular food the minute.
There were no choices.
Yeah,
yes.
they didn't have choices.
Well, I mean,
besides milk.
Going back to Pottinger's cats, which you know how much I love to
here we
talk
go.
about epidemiology.
Why did I bring this up?
I mean,
I'm sorry, Elise.
That is one of the main things you start to see, though, in malnourished cultures, is that the jawbone does not form efficiently. It's a massively large bone. I mean, aside from like the femur, I mean, it's really a very dense, large bone, and it has a lot of chemical tension on it. Our masseter is the strongest muscle in our body.
Physical tension. You mean.
Physical tension.
You said
so
chemical.
Oh, sorry. Yeah. I mean physical. Yeah. They're not chemical. Well, I mean acid, but that's not touching your jawbone. But that tensile strength that it has is pretty impressive. Mm-hmm. Like despite our recent trauma call with all the broken jaws, the jawbone is very, very strong. But if the mother is underdeveloped or is undernourished, then that development phase of the jawbone is less. And then if you're feeding your kids, you know, squeezy yogurt until they're 10 years old.
That's like every listener.
I mean, it makes me really sad to walk
All
down.
the moms listening right now are like, I've destroyed my kid's jaw.
Well, they're chewing food now. You know, you walk down the baby aisle in grocery stores now, even like a health food store, and there's literally no jars of anything anymore. It's all just squeezy packets.
Yeah. So I think what you need to do is go to the pet store, get one of those chewy toys you give a small dog, and just give it to your child.
They make those for children. You don't even have to go to the pet store.
Right. It's cheaper at
they're,
Petco.
They're teething rings. Yes. Oh, we got way off, Elise. Sorry.
That's
right.
good.
Yeah.
Good talk.
Well,
hey, who's that good-looking guy there?
See, Nils is sick of you wanting the phone number to spin around your head. He made you a slide.
Okay, that's good.
So we would love it.
He's lazy. I just want CGI phone numbers coming around.
Zooming around your head. So if you would like to have your question featured on an episode of our podcast, we would love to have you leave us a voicemail. You can leave us a voicemail at 303-630-9038.
Give us a shout out where you live. I like the fact that we know.
I do like hearing where people are from.
You know, people are from Seattle or from northern Colorado. Northwestern Colorado, y'all.
So yeah, love your questions. If I don't answer your question immediately, it could be because I'm saving it. Usually I'll tell people like when we answer a question, if I've left it, I will shoot you a little message.
That's tough. So if you ask a question and you respond right away and you're like, damn it, she's not using it.
But some of those I've used in the past.
Okay.
Like some of those I have, but it's like something where like I feel like I need to answer because it's probably kind of urgent that this person maybe needs to know this, or they had a question that was a little more pressing. Yeah, so sometimes I will answer and still use it later. Right. But voicemails,
And if anybody listening thinks they can go through me to get to Amy to get your question answered, it ain't happening. I don't get to choose the questions.
Oh, I'm like, what are you getting at here?
Boss lady.
Yeah. Questions come to me. So thank you everyone so much for listening. We really appreciate you leaving us questions. It helps us out so much. And if you would be so kind as to leave us a like, a comment, a rating, review, share us. We would love that. We really do appreciate it.
And we appreciate you.
We'll see you next time.
Bye.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty, and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.